This idea 8 years ago was my vision, and nobody wanted to invest in it. No one believed in it. Virtual care wasn't a thing. Within the first few months, we started doing thousands. By the first year, we covered 4.5 million lives. NASA did the vetting for our technology. Welcome technology. If they take all our jobs and everyone get access to care, call it a win.
Hi everybody, welcome to the Devico Breakfast Bar. Here we speak with different people involved in the business landscape, share their expertise, delve into the latest tech trends, and explore the ins and outs of IT outsourcing. I'm Oleg Sadikov, and today I'm excited to have Ramon Lizardo, CEO at Tele911. Don't forget to subscribe and hit the notification bell so you don't miss new episodes. Hi Ramon, and thanks for joining me today.
Pleasure joining you, Oleg. Thanks for inviting me.
Let's start our podcast with a little blitz. I start a sentence and you continue. Okay?
Okay, go for it.
My position as the CEO gave me
the power to transform the healthcare landscape in the US.
My position as the CEO deprived me
of time with my family, which is probably the most hurtful thing.
My main superpower is
the ability to connect with people. Connecting with people is what's allowed us to build this amazing company that's affecting so many lives.
My main weakness is
my two kids, because they can pull me from any project that I need to be doing for sure.
And the last one, when I'm afraid, I
go for a run. It's my thing in order to clear my head.
What initially sparked your interest in the healthcare industry, and what keeps you motivated to work in this area?
You know, that's a great question to start with. So I am not one of these typical people that was fascinated about being a doctor. I borrowed someone's application in medical school and did not see that person again. And that was the one application I filled out and got it. Right. So I was never the one that was like, oh, I need to be a doctor in order to serve people. I always had a calling for the sciences. I was fascinated by the medical field, but I was never the one that was like, if I don't do this, I'm going to die. Along the way, what I realized is as I matured and as I grew as a human, I realized, wow, there's an opportunity here to serve. This is a career that we should treat with utmost respect, because you have people's lives in your hands. And then as I matured later on in my 20s, I realized, how do I expand this idea of serving and build something that's gonna have an impact, not just one person, but multiples at the same time in order to maximize the resources.
Could you walk us through what led you to focus on ER division?
I think it was a many different points. I think the first point was understanding the community that I belong to and understanding how at times minorities in the US use the emergency room as a primary care setting. And then working at a hospital, understanding that as a clinician, you're signing up as in emergency medicine to save lives. And then you start experiencing something different. You start experiencing those same members of your community that now are coming using this as a primary care setting. And then as I continue to grow in my career, one of the things I realized is, wait, fiscally, this damages the entire ecosystem. It's basically the highest cost. People are using it multiple times. It becomes an unnecessarily balloon and spend. And then when you actually need it, it becomes a bottleneck because they're attending to other people that don't. So I realized this was quickly one of the main problems. And then I realized it is the main problem in healthcare. And I said, hey, I want to solve for that.
In your experience, what are the main obstacles to integrating telemedicine with traditional emergency services? How does Tele911 overcome them?
You know, one of the things that I've been fascinated is in my lifetime, I've been able to see the evolution of healthcare and the acceptance of emergency medicine. Actually, when I was in medical school, this wasn't seen as a thing. Virtual emergency medicine didn't exist. Actually, most of virtual medicine, I don't recall even thinking about it. And then the pandemic hit. And the pandemic hit right before like Zoom got popular. And then a virtual medicine was the only way people were experiencing medicine. And it became a norm instantaneously. But yet still, virtual emergency medicine was not a thing. All other specialties were able to get their own little niche, right? With the exception of emergency medicine, obstetrics, and surgeons. Right? Those were the three that was like, hey, no, you got to come in and actually execute on that. I realized the uphill battle. But I also realized that the community was still using emergency medicine as a front door. And I realized, well, now is the time to make sure that those bifurcate and actually advance on a problem that we need to solve. And that's how we ended up building. I mean, it's literally one of the nation's largest emergency medicine practices now.
Remote surgeons do exist in our days, so now it's a new reality. Based on your decade of experience in healthcare, how do you envision the future of emerging medicine and ER division evolving?
I'm fascinated by this question because I'm creating it. I think on one aspect is I think actually this is becoming the standard of care. There's a reason why Tele 911 has a backlog of 336 counties now in our pipeline waiting to come on board. This is literally becoming the process. 45 million more lives are going to be added within the next 15 to 16 months here at Tele 911, which covers over 10% of the US population. What I'm thinking about here is I'm going to get to see that in my lifetime. In my lifetime, I saw this platform not really exist, early adoption from COVID, insane adoption from emergency medicine through the virtual care through Tele 911. And now we're going to see the future, how this is going to be the standard. How is this going to affect the healthcare landscape? Is a few ways. First of all, what we're going to be able to experience is a real efficiency in the system where people are going to be able to go to the emergency room and actually the people that really need it receive the care that they need. But also the majority of the US population, over 81%, goes to the emergency room. It's going to be able to receive that care at home. And what we're going to be able to see is a change in cost, a change in appropriation of funds, right? And we expect to see that all in the next 5 years because of systems like these.
If you could predict one major AI-driven advancement in healthcare over the next, let's say not 5 years, but let's say 10 years, what would it be?
So as a clinician myself, one of the things that I realize is even though that human to human interaction is powerful, what we've seen is AI, one, is more accurate, right? Two, is faster, right? Three, it creates a level of redundancy in itself that allows QA and QI in steps that we definitely need. But right now, remember, we see thousands and thousands of patients all the time, right? And then we have to go back and QA, QI those clinical steps. I think all those processes within the next 3 years are going to be instantaneous. And part of those decision-making processes, at least on the clinical end, are going to be suggestion based, but they're still going to be there and they're just going to create additional efficiencies. And in the next 5 years, I truly believe there will always be a layer of human on top, but AI is going to be helping us on the decision making for clinical aspects as well.
So you are not from these guys who are saying AI will replace everyone.
Well, listen, in order to expedite the access of care in a timely manner, as long as we're following clinical guidelines and as we see large language models actually expand, I want, I welcome it. Listen, I'm not afraid to lose my job for more efficient care. I want that. Do I want oversight? Always. That human component should be there. But no, welcome technology. If they take all our jobs and everyone get access to care, call it a win. That's the end goal here. But again, I'm a proponent of bringing it in as long as we have a human component all the way at the top, right? Making sure that we're able to step in and say, actually, no, this looks a little off. Let's do a double take on it.
Okay.
Which, by the way, that's not the popular view. I just feel like everyone's like, no, but, let's keep the jobs and things like that. And to be honest, Oleg, I think that's so archaic. That's like saying, hey, let's not invent a vaccine because we need patients to have HIV in order to run things. Let's not invent antibiotics because we need pharmaceuticals to develop antiseptics. No, that does not make sense. We're going to have other problems. By solving this, it creates a space for these new genetic mutations that are coming out in 10, 20 years because of what we're eating today, because of what we're exposed to today. We're going to have new diseases come out. Let's solve for those. These virtual emergency medicine that are really primary care, we should be able to sweep this out of the rug in a few years. Or at least that's how I feel.
Antibiotics stop working, problems you mentioned. Yeah, we definitely need something new coming. How emerging trends in digital health influencing your work at Tele 911?
various emerging trends that we always have to consider. One, for example, AI is one that we always take into account for efficiency because of the volume that we do. Oleg, when we launched last year, we're going on 2 years. The goal was to do a few hundred patients. We're like, hey, if we do a few hundred, it's a goal, it's a win. Oleg, within the first few months, we started doing thousands. By the first year, we covered 4.5 million lives. We've quadrupled in numbers just in the last 19 months. I'm living my wildest dream kind of thing, right? But because of that, I need to be on top of what's coming ahead. Because that same way, you still have to solve all the other problems that everyone has to solve for. Billing, credentialing. The US has such a convoluted system that you have to make sure that you keep those top of mind. But what's fascinating about this, because we have such a big data set, we're able to tap into those solutions and see if they work at scale, if they work within our patient population, if they work across different states. And we're able to do that instantaneously because we've built incredible practices across California, Texas, Florida, Maryland, and now we have a few other states that are coming on board. It's a different monster that we're able to test at, which is fascinating.
What does your typical day as CEO look like? How do you balance your time between strategy, operation, and patient care insights?
Well, let me tell you how my day starts before my day, right? So one of the things that I've committed to over the last 2 years is 5 miles at 5 a.m., and I've been able to keep it up. To me, that's my place to think, breathe, digest a lot of these ideas from last night. When I come back from those 5 miles at 5 a.m., usually I get changed quickly and then I start getting the kids ready for school. I'm the type of father that I like to take my kids to school. I like to be present. I come back, shower, then it's a series of meetings. My day is usually divided like this. The beginning part of my day, I do executive debriefs with my team. Super important for me to have a pulse on everything that's going on in the company. By the middle of my day is when I start taking very important meetings with health plan executives, with venture capital companies, solving things with key organizations. I'm responsible to keep the juices flowing there always, right? And then the meetings that happen at the end of the day are basically meetings with peers in the industry where we discuss some of the operational challenges at the company, where we brainstorm how to scale. Like when we look at operational leaders at VC and say, hey, how would you onboard 336 clients, equating to 45 million lives? Let's talk about that. And usually by the end of the day, there's 1 or 2 members of my board that I like to touch base with. Not every day, but at least 2 to 3 days a week, for the reason that they scale billion-dollar companies profitably. And the fact that I have the access to be able to call them constantly and pick their brain is probably one of the key aspects of why Tele911 is so successful.
Can you share an example of tough decision you had make as the CEO to improve Tele911 service or patient outcomes?
Let's talk about a decision that we made last year that really pushed the limits of healthcare access across the whole US. So historically, when a health plan or a healthcare entity receives information about their members, it's usually 90 days late. They're using this like billings and claims data in order to learn about their members. And yet they're expected to take risk on their members, which is like the most ridiculous thing. It's like taking a risk on a patient that was here 3 months ago, right? How do you even follow up with them? It had never been done, but I wanted to prove that it could be done. And we did it because of the technology that we put in place. Every health plan and healthcare entity that we partner up with in real time knows when their patient is calling, why, when the ambulance showed up, what happened with that clinical assessment, where they went to the hospital, what happens at the follow-up. And I'll tell you, that 5 years ago, I scribbled and said, what if this happens, right? And now to see, wait, that's the standard now? Now we talk about it like it's nothing. It's insane. The fact that the whole industry moved 90 days late and we said, yeah, we're going to make it instantaneously. And it worked. It's just insane, honestly. So it's really cool to be able to see these technology and these advancements in technology happen so fast.
What are some of the most valuable lessons you have learned from your journey in the healthcare tech industry?
I keep telling people, you're seeing a rocket ship now, but what you're not seeing is the bones of failure. Like if you go to see the statue of David in Italy in academia, what's fascinating is you walk into this room and this magical figure that's like 40 feet tall and you're like experiencing this and you're like, whoa, someone chiseled this by hand. And then you make a left, and what you see is all the times that something was started and never finished because of a mistake. And you, after seeing the Statue of David, have to walk through this long room in Italy, in academia, about all these starts and non-stops. And when I tell people, okay, you're seeing this rocket ship, but what I really want you to see is all the times that I failed. This idea 8 years ago was my vision, and nobody wanted to invest in it. No one believed in it. Virtual care wasn't a thing. Access to emergency medicine in under a minute was stupid, right? Like access 90 days late. I mean, it's just all these ideas was incredibly just so far-fetched. And I want to make sure people recognize that part of the story too. That's the part where the gladiator's bleeding and no one sees them. They're just seeing this glory. And it's so important to recognize those bones that helped us through the way.
What's your philosophy on IT outsourcing, particularly when it comes to maintaining quality company culture?
This is something I feel very strongly about. Companies, when you're starting off, outsource everything. You are literally building a concept. You're not building a company yet. You have an idea. You're building a company. Outsource talent, outsource tech, outsource everything. Run through kinks. Make sure that it works. And then you build internal. I keep telling that to people because what I've seen is companies spend an incredible amount of money internally, but you're not ready for that. And as an investor myself, I see some of these companies make these mistakes all the time. You have to pick a really good partner in order to maintain quality control because you're picking these outsource. And what you're saying is, hey, you're going to represent my brand. You're going to be part of our story. I'm trusting you that you're going to scale. I'm trusting you that you're going to deliver. Every time you press that button, something's going to happen. So you have to be sure that that person understands quality control as much as you do and cares as much as you do about quality control. And that's something that you have to figure out on the vetting process before you ever sign a dotted. One of the biggest mistakes we've made at Tele911 is we chose a partner that it was just the wrong partner. So we chose a partner that people would press a button and nothing would happen. And that was the experience the first few times. And because that was the experience the first few times, people stopped believing it early on, which is horrible. And quickly we had to pivot. We chose the same partner. It's the same platform that NASA uses to communicate with the NASA space station because we know they're not going to fail, right? Like that's not a time for interruption. And that's the same technology we use in order for our doctors to communicate with our patients every single time.
Are there specific regions or countries that you find particularly promising for tech talent?
Here's my experience. For some reason in America, we always think, made in America. We got to use American. We got to do this. That's really archaic. Hey, there's a lot of tech talent that's moving to Mexico, that's moving to Argentina, that's moving to Europe because, hey, this is just one, it's really expensive. Two, people now have remote work and they're able to experience elsewhere. Also, because of the information age, talent overseas is able to get the same tier of education or sometimes even better than what we have here. Well, we were going through all these subjects at schools, they were building. So by the time they're showing up to an interview, hey, they build 10 apps. They build 2 companies. So the level of quality of talent is insane. Actually, our entire tech is run by talent overseas. The only people that oversee that division are the people in management that are here in the US. And those are the people that report to me. But our entire tech team is managed by talent overseas. Super important. What does that allow us to do? It let us cut costs to 1/10 of the overall price that we were paying previously, or if we would have onboarded this internally. And we've only missed 2 consoles in the last several thousand consoles. Talk about quality. And those we double clicked on, and it was a human error from our clinicians, right? It wasn't even a technology. So that's what's fascinating about this era, where we're seeing phenomenal talent overseas and we're using it. We're taking advantage of this, and we're not going to stop.
In your experience, what are the key factors to consider when deciding whether to outsource a particular function or a project or not?
Well, here's the thing. I see it differently. I see it, you should always outsource, especially in the startup stage. You should always outsource because you're building a concept. If you're running a Fortune 500 company, then you should start outsourcing certain aspects in the US. But at the startups, at companies less than 300 employees, always outsource. You're building equity in the company. You're building value. You should not be overspending. That money should go to delivery, towards research and development, towards building new product. Why are you paying UX UI designer 200K here when you could get one in Ukraine or another Eastern European country for 60,000? And then you use that 140,000 partly for QA, partly for new products, partly for development, right? And then you just didn't blow your budget on one thing.
What advice would you give to smaller companies or startups considering outsourcing for their first time?
As I said before, you got to vet the company. You got to vet other major clients that they're using. Do they have partnerships with major customers that everyone recognizes? Not just you, not just your peer. Everyone recognizes. I'm in the healthcare industry. Do you have a major hospital system? Do you have a major pharmaceutical company? Do you have a major lab company that you're servicing for? That's credibility there. Look for those partners because somebody already did the hard work for you. Because trust me, they're not just bringing in any shop in order to do the work. They already did the vetting. NASA did the vetting for our technology because they're using it. And then we just said, yeah, we'll use it too.
Ramon, thanks for your time. It was emotional, amazing, interesting conversation. I really enjoyed talking to you.
Awesome, me too. Oleg, you asked a really good questions, particularly for the space. And I really enjoyed getting an invite to be on this podcast and answer some of your questions.
Sounds great. If you enjoy our discussion and want to stay updated on future episodes, don't forget to subscribe and hit the notification bell. That way you will not miss out on the latest insights and conversations from the Devico Breakfast Bar. See you in a week.